Welcome. Okay, call this meeting to order at 4 o'clock at the Central Administration Building, Boardroom, 425 East 9th Street, Reno, Nevada. It is 4:01, and we'll go to 1.02. Roll call, please.
All right, Jeff Boswell, I'm present. Eric Diamond, absent. Mike Dixon. Here. Rachel Drake.
Here.
Vicki Cooper.
Here.
Diane Lyon.
Here.
Tony McMillan.
Here.
Tony Marestro.
Here.
Don Echeverry.
Here.
Robert Munson.
Present. Okay, we have a quorum.
We did.
Okay. Item 2.01, presentation and discussion of the Washoe, 2.0, public comment? Okay, do we have any public comment? No? Okay, thank you for reminding me. Presentation, discussion of the Washoe County School District Group Insurance Claims Expenditure or Experience Report as of May 2022. Discussion only. Good morning, Lloyd. How are we doing?
Good afternoon. Good to see everyone. My timing was perfect. Okay, yeah, so let's look at our June data here. So we've got Exhibit 1, as you can see up on the screen. A few months into this plan year now, and as you can see on the executive summary, enrollment counts are down just slightly, down about 1.4% from an employee standpoint, about 3% with the dependents. Paid claims for medical RX dental vision on a composite basis, on a net overall paid claims is down about 3.6%, $5.367 million average this year compared to 5.5 last year, which on a net composite basis is running at 763 versus 780 last year, so down about 2%. Adding in the fixed costs, which are also down nicely at about 7%, comes up to a grand total of 5.7 million versus 5.9, it's basically 6 million last year, down 3.8 for a composite cost of 818 this year. Large claims has been still very favorable, running at 4 this year compared to where we were at last year at 28. But again, we're still very early in the year to make much out of that. Our graph on Exhibit 2, which we've been spending a little bit more time with over the last few meetings, you can see there that things have calmed down a little bit, which is nice. It's always good to see, not going up at the rate in which we were going up in some of the previous months. And then moving forward to Exhibit 3, which is our all plans combined cost summary for the month, looking at specifically June for employees and retirees. Again, our enrollment counts are down.
Excuse me, Lloyd. I'm sorry to interrupt you.
Do we have something different?
We're doing May
Oh,
because
'cause
yeah.
you didn't
So
get-
I know
you
you're
didn't get
saying
your June in
June. We
time?
just can't see the June numbers, so you can go ahead. But we're going to repeat June again next month. Just
Thank you.
okay. Sorry about that.
So scratch everything I just said. We got the June report done, was it yesterday, I think? Yesterday or the day before, and sent that over, so I thought they were going to be including it, but that makes sense that they did not. So looking specifically at the month of May, our enrollment counts, running around 7,000, just slightly over 7,000. And as we go down on line 10 for June, we had 4.4 million for employee costs. On line 18, 1.4 million for, I'm sorry, I'm doing it again. 1.35 million for dependent costs, and then on line 30 combined 5.875 for a total cost per employee for claims of $834. And then as we add in the fixed cost of $390,000, gives us a composite cost of $889.77. So overall, we are still down for the year. I have to look at that one now. $800 composite cost per employee versus $839 so down about 4.5%. Did go up just a little bit for June, and we'll talk about that next month. Moving on to the large claims report, which is,
Shows 3.
what's that?
Shows 3.
Thank you. On Exhibit 12, for the month of May, we had 2 new claims start to be tracked at the $200,000 level. And 2 more subscribers, one at $315,000 and one at $230,000. So, there we go.
There we go.
So we'll revisit June next month. But it's pretty close to the same. Yep. IBNR, oh, nope, that's it for this one. Questions? Fairly straightforward.
Questions for Lloyd?
Thank you all.
Okay, thank you very much. 2.02, presentation discussion of the Washoe County School District Group Insurance Anthem Claims Activity and Turnaround Report as of May 2022 for discussion only, information and discussion. Welcome.
Hi, Pam Davidson from Anthem for the record. All right, so I have this on my phone real quick. So do you have the medical up there right now? So the medical in May, we had 13,315 processed claims. Within the first 14 days, 97.83% were processed. In 30 days, it was 99.72. 60 days, 99.93, and in 90 days, 99.95% of those claims were processed. Out of those, we had 12,024 were part of the PPO, and 1,291 were part of the HSA plan. The RX claims came to 7,488. I'm not sure if you have the exact same report as I do, because we had repopulated it at the end of June again. So the numbers might be off by 1 or 2 claims on the RX portion. Okay, if you want to move on to the dental. And with the dental in May, we had 1,959 claims that came in. 91.89% were processed in 14 days, and the remaining were processed within 30 days. There has to be a, dental is always done within 30 days of the claims. Does anyone have any questions on the turnaround report?
Any questions? No? Seeing none?
No. All right.
Thank you very much.
You're
Appreciate
welcome.
it, Pam. Okay. 2.03, presentation and discussion of the Washoe County School District Insurance Wellness Program. Report to cover current events and programs as of June 2022. Welcome.
Hi everyone, Mackenzie Howard for the record. So for our first update, I have a follow-up from our previous meeting that we had. So if we look at the first table here, and we look at the column all the way to the right, these are the numbers that I brought you last time, showing that we had a total of 204 employees reaching out to our EAP. If we look to the column immediately to the left, this is the numbers from last year, from Q1 of 2021. So we can see that our utilization rate was actually down compared to last year. I know last meeting we thought that this 204 number might have been a little high. But I have included our total for all of 2021, which is 959, which I think looking at the 204, we're still pretty on track, around the same as last year. The second table that I have included breaks down what our members are reaching out for, and I think that might have been a confusion last time as well, with me just saying whether they were reaching out online or on the telephone. So of those 204 members, this is what they're reaching out for. Our most common service that they're reaching out for is that confidential counseling, which is the EAP at the top, and then we can go down from there. These are accessed through articles, videos, phone calls, anything through the Guidance Resources website. That's where that 204 number comes from. Our next update is our Virgin Pulse.
Can I just ask a quick question?
Go
It
for
says
it.
Family Connect. What does that mean?
Sure. There are a lot of resources, including articles, videos. You could also call on the phone to talk about family issues that you might have going on. And so that's just a category that we can separate that access into. It's more so just the topic that people are reaching out for.
Okay, thank you.
Of course. So next we have our Virgin Pulse challenges. In June, we had our process bias challenge, and our average participation was 136 members. In July, our habit challenge actually just ended. And this one was a keep it routine. So it asked our members to pick a new routine that they wanted to implement into their daily life. I looked this morning and our average participation was 108 members. And our last update for today is planning. Our wellness screenings will be held back at all of our high schools this year, as well as also a few locations here in this room. We also will be offering vaccines at our wellness screenings. Does anyone have any questions for me?
Any questions?
I had a question.
Oh,
For
go ahead.
the wellness screenings, will you also, I think in the past they did cholesterol and those kind of checks. Do you have those?
There will be some additional labs that'll be all written out for members, but the basic will be a finger stick. Yeah.
Tony?
Will there be Saturday
There
screenings?
will be Saturday locations too.
Okay,
Yep.
more than one.
Yes.
Thank you.
You're welcome.
And I take it we're still not doing a health fair type of thing? We're just
As of
gonna-
right now, no, not
Okay.
right now.
Okay, thank you.
Will there be COVID shots?
Potentially. I'm going to leave you in anticipation.
I wasn't thinking you'd be able to answer.
Immunizations. too.
Any other questions? No?
Okay.
Okay.
Thank you very much.
Thank you.
2.04, presentation discussion of the Washoe County School District Group Vision Program and possible action to recommend the superintendent renews the Vision Program contract renewal with VSP to include the choice plan with an increased frame allowance of up to $170 and contact lens allowance of $140. This would be effective January 1st, 2023 with the new plan year for a 4-year period of annual cost approximately of $108,219. Okay.
Great. So Rachel from VSP will present this. Rachel, can you hear us? And
Yes.
Okay.
Yes, I can. So do you want me to share my screen or do you have the presentation on your end as well?
we have it on our end, but either way, whatever's easiest for you.
Okay. Yeah, let me go ahead and cover what's up here. And I'll be honest with you, I can just see the top half. So I'm just going to grab my copy real quick. Is there any way that I could have you guys maybe move this template up just a little bit, just so I can kind of speak to the bottom half as well?
Veronica, is that you up there? Can you put the actual presentation up first? There we go. I think that's,
Oh,
can you see that, Rachel?
I can. Yes. Thank you so much. So I am Rachel McCluth. I'm with VSP, and thank you for allowing me to join your meeting today. Washoe County School District has actually been a client since 1992, so we appreciate the partnership, the long-term partnership, and we're excited to still be a part of your benefits program. So we'll go ahead and go to the second slide. I just wanted to show just a quick recap of what your vision plan design today looks like. And we did prepare these reports for the meeting that was to take place last month, so I do apologize, but the numbers are actually through the end of May, not June. So still pretty accurate, but just through the end of May. At the end of May of this year, we had almost 7,800 members enrolled. That's great enrollment. You currently have the VSP signature plan in place, which allows members to get an eye exam every year, lenses every other year, and frames every other year. We do have a $10 total copay for members, meaning if they go in and they just get an eye exam, they pay a $10 copay. If they get an eye exam and glasses or contacts, they still just pay that $10 copay. The current frame allowance is set at $130, and the current contact lens allowance is at $120. Some of the different covered lens enhancements that you have in place today are standard progressive lens coverage and also polycarbonate lenses for children. We also have our essential medical eye care program, which does allow additional medical coverage for eye-related medical conditions like pink eye, and that will cost a member a $20 copay for that. But it also, the idea behind that was really to keep sick members out of emergency rooms and urgent cares, especially during the pandemic. If it's something like pink eye, those members really should be going to their eye doctor versus an ER. So we just try to make it very easy for members so that, number one, they're not sitting in a room full of sick people, but also two, usually the copays are a little bit higher for those ERs and urgent cares. And then are there any questions on the actual plan design before we go into the next slide? I know I kind of breezed through that. Okay, perfect. I also just wanted to provide a little bit of utilization so that you could see how your plan has been running over the last couple years. I did not include any 2022 data. This is really just year-end data for 2021, 2020, and 2019. Really, the idea was just to kind of show you how numbers have fluctuated over the last, I almost said 12 years, over the last 3 years. I don't think we want to go back 12 years. So we'll look at 2021 first. We had an average enrollment of just over 8,000 members last year. We paid just over 6,800 claims. And then if we look at 2020, we had higher enrollment in 2020. We did have less claims. And I'm sure that we can all, we all know that that was probably pandemic related. So a little bit of little fewer claims in 2020. However, we do expect that those members made up their services in last year and probably even into this year. If we look at 2019, we had over 8,200 members enrolled and we paid over 8,000 claims for that year. I always like to show how your members are using their actual benefits. So what I've done in the bottom grid here is I've showed the same 3 years, and then I've broken out the exams and the materials. So just for example, we'll just go with 2021 for now. We won't talk about the other 2 years unless you have questions. But we did have 5,306 members that took advantage of their eye exam benefit in 2021. When we look at all of the claims, we had 54% of members who received an exam only. And for those members who selected materials, we had 76% of members that selected materials purchased frames and 19% purchased contacts. We would imagine the difference between 100% and the figures that you're seeing here are either folks that went out of network and just did not submit an out-of-network reimbursement. So we can't count those here. So that's why the numbers do not add up to 100%. But you can see your numbers have remained pretty steady over the last 3 years. I would say 2019, we had the highest enrollment in that year. Well, I shouldn't say that. We had higher enrollment in 2020. But if we look at actual claims, we had higher exams in 2019. So my guess is that that's probably the year that everybody is going in and getting materials. Since you have lenses and frames every other year, it's probably every other year that members are going in and getting services, if that makes sense. So any questions on utilization?
Don't see
And
any
this is
questions.
just a very quick, oh, sure. Oh, no questions?
No questions.
Okay. And I apologize, that's just kind of like a quick snapshot, but it really kind of gives you a good overview of how the plan, how your members are using the plan. Something that I always like to point out is this slide here. So at VSP, our focus really is on the health of the eye versus just dispensing contacts and glasses. So anytime a member does receive their annual eye exam in a VSP eye doctor's office, And we did see over, 5,306 members just in 2021 that received an eye exam. Members are going in, they're getting that eye exam, but doctors are also looking for different medical conditions that can be detected through just looking at the retina, so at the back of the eye. And any time that we do detect one of these diseases, we are noting that in the patient's file. So just with your population in 2021, we did have 100, and let me back up real quick before I shout out all of these numbers. I just wanted to be clear that many of these folks are people that went in and they already knew that they had these conditions, but many times members don't know that they have these conditions and they're finding out for the first time. So with that said, we had 145 members that were detected with having diabetes, 203 with high cholesterol, 265 with hypertension, 28 with glaucoma, 31 macular degeneration, and 12 with diabetic retinopathy. So again, these are conditions that are detected through that eye exam. So if members are not going in to see their medical doctor for their annual physical every year, they may not know that they have these conditions, but if they can't see, they're probably going to their eye doctor. And that's where members are finding out for the first time that, hey, I've got this condition. I feel great. I look great, but my doctor is telling me I have high cholesterol. I have, high blood pressure. So it's why we really do, speak to the eye exam as much as we do. It's the most important component of your vision plan. So again, these are counts. There are folks that already know, some that maybe don't know, but it's just very important that we at least speak to that eye exam and at least promote that, if nothing else, as a part of your vision care benefit. And then we can go ahead and go to the next slide if there's no questions. Kind of backing up to, we talked about what your plan design looks like today. Your current frame allowance at the school district is $130. We took a look at all of the frames that were purchased last year, so all of 2021, and we had 2,061 frames that were purchased by members. Over 1,900 of those were actually more than the $130 allowance. So really, that's 18% of all frames that were selected were covered in full. So what we're proposing for next year is to bring the school district a little bit closer to what the industry standard is, but also closer to what your members are already purchasing and spending on glasses today. So we came up with an average amount of $170, and that is pretty consistent with our entire book of business. So every couple of years, we might want to take a look at just increasing that frame allowance, just so that it is up to par with, the industry, your competition, other school districts. We want to make sure that your employees have the best benefits they can for their vision. We also did look at, 2020 just to see how those numbers looked as well. And as you can see, over the last couple of years, we have had a considerable amount of folks that have had to spend some out of pocket because they didn't have enough to cover their glasses. So any questions on the frame portion?
I have a question.
Pretty cut and dry.
So this is Rachel Drake. My curiosity is, do we know on average what our members are spending? Because I still see a significant number of our members who are spending more than the 170.
Oh, yes. So we actually pulled the reports and we took a look at, let me see how far back do we go. So for this particular conversation, the report that I have is for all of 2020, so calendar year 2020. I would say the majority of your folks are spending over $200. However, we wanted to keep costs, as low as possible. We wanted to be able to give your employees some benefits that really were beneficial to them, that were really going to have an impact, but not impact the rates too much. So 170 is kind of where we settled. We could certainly look at the cost to increase that a little bit more if you'd like, but that's kind of the number that we chose and we recommended.
Thank you.
You're welcome.
No other questions? Okay.
next slide is actually just kind of more informational, if anything. If you're enrolled in the vision plan today, you probably are aware that anytime you purchase one of these brands here, you get an extra $20 to spend on frames. So just going back to Rachel Drake's question, she had mentioned, hey, we know that a lot of these folks are spending more than that $170. So if we take a look at the current allowance of $130, if a member were to, let's just say they buy a Calvin Klein frame, they actually have $150 to spend. So that $130, it's $130, but if they select one of these, they actually have a little bit more. And with that $170, members will have that additional $20 and have $190, which will get members closer to that $200. So that's a great benefit. This extra $20 is already in place, and it would remain in place, obviously, for the duration of the contract. So this benefit is not going away. It will just continue to add benefit to a member's frame purchase. And we try not to change these logos out very often. So we don't expect to see any gone for next year. If anything, we try to add, not take away. So I don't foresee any of these logos going away. I will just say we had, off to the right-hand side, when we looked at all of the frames that were selected in 2021, 38% of them were one of these logos. And I kept this little part on. I don't know that we confirmed that we were going to add or not add, but instead of doing an extra 20, we could always offer an extra 50. That's just an option. I'm not even sure if we priced that out, Laura, I apologize, but that would be an option. So if you wanted to add that 20 is something that can be changed, and we can raise that to 50. So any questions on the logo? Or I should say logos. And then we're wrapping up here. We just have 2 more slides, so hang in there. I just wanted to also present just kind of a quick snapshot of what the network looks like for VSP. And if you've been a long-term VSP member, you probably remember back in the day when VSP only had private practice facilities. So we've come a long way since then, and we have not only private practice, but we also have a ton of retail locations. Like VisionWorks, we actually purchased VisionWorks back in 2019. So we actually own them. We have a ton of locations throughout the country. Walmart, Sam's Club, Costco, Pearl Vision. Those are just some of the big names. And I didn't include them all, but these are just some of the names that we have in network that are retail. I do want to point out one thing too. If you look kind of towards the top where you see the Vsp Premier Program, we're going to talk about that on the next slide. We talked about VisionWorks, but I also wanted to touch on Iconic. For those of you who are not aware, VSP does have its own online shopping portal. You can access it through vsp.com, or you can go straight to iconic.com. And you can actually, it's benefit integrated, meaning that once you've gotten your eye exam at your VSP eye doctor's office, that eye exam, that prescription is actually loaded into the system, and members can go to Iconic and they can actually use their benefits to purchase glasses. They're able to access their prescription and also make a purchase of either glasses or contacts using their own benefits. And then those glasses or contacts are then sent to the member's home. If any tweaks or adjustments need to be made, members can take those back to their eye doctor, and there's no cost to make those tweaks and adjustments. So kind of a really nice feature that we have provided members. I want to say Iconic kind of opened up probably 4 or 5 years ago, but with the pandemic, it's been really a great tool for members to be able to just go in and buy what they need online. And then on the last slide, I mentioned the Vsp Premier Program. This is something, it's actually a rather new program for VSP. We're really excited to see, where it goes. It's something that we rolled out last year. Premier doctors. So anytime that you're looking or a member's looking for a VSP eye doctor, if they see this little orange Premier banner next to that eye doctor's office, it means that that particular provider offers more selection of frames. They offer additional bonus offers. So they're basically offering more than what your plan provides today. They're just kind of little special discounts and offers. They also have the highest or the latest high-tech exam equipment for, retinal imaging, things of that nature. But also, too, I think probably the most valuable benefit out of the Premier program is the Eyewear protection program. If a member goes in today and they see a Premier doctor, and let's say in a couple weeks or a couple months, they're out and about and their glasses break, they can actually take that pair of glasses back to their eye doctor and they will replace that same pair at no cost. And that's a huge deal because if you wear glasses, you know that they're not cheap. So to be able to, if your glasses break, it's beyond your control and you need your glasses, you can go back to that same eye doctor and they will give you the same pair at no cost. So again, that's something new that we rolled out last year and it's in place today for members. So I just wanted to make sure that you also knew about that moving forward.
Quick question. Is there a place on your website that lists all of the Premier locations so that you can look before you start going into some place and have to look at the window as you're walking in?
Yes. So I have not, I'll be honest with you, I have not looked at our website probably in a couple weeks. We are actually going through a new rebrand at VSP. So we are rebranding our logo and we're making a lot of changes. So I have not been on our doctor portal, like I said, for probably a couple weeks. But what I will tell you is when you go to vsp.com, there's a portal, a tab that will say find a doctor. And you can find a doctor in, your zip code, your city, your state. And they will have, if they're a Premier doctor, they will have that orange banner. And they might even have a new portal where if you're just looking for Premier doctors, they have that available too. But I don't believe we have that yet. I think you have to kind of go in and search by, your area. But as long as they have that orange banner, they're a Premier doctor. And they offer these benefits that you see here.
Thank you.
You're welcome. And that's pretty much it for me, but I did just want to wrap up and say, any changes that we do make for next year, even if we don't make any changes, we will be revising the benefit summary just to kind of, have all of our new rebranding on there. But we will also include messaging around that Premier program. So we will keep that, right on the benefit summary so members know to at least look into that as an option. But again, at VSP, we allow members to go wherever they want, but the best benefit is always in network, and Premier is definitely a great benefit for members.
Okay, thank you. Any questions? I have a question just quickly, probably for Laura. The $108,219 for this contract, how much more is that than what we would have paid if we just stayed with our current benefits? How much of an increase is that?
So we have, sorry, I don't think that the attached numbers were in your packet, but they're up here on the screen now. And then Rachel, do you want to speak to that?
Sure.
The revised, okay. Thank you.
Yeah, so the school districts, you're actually looking at an increase regardless. So if I can have you just scroll down just a little bit further on this. Keep going, sorry. Keep going. So right here. So to keep your current plan in place, you were looking at, let's see here. You were looking at $1.15, so $1.15. If we looked at, and I should probably back up because I see that you've got the 120 here. So with the 120, I think that was if we were to, one quick second here.
So Rachel, I think the 120 is if we renew at our,
With
correct me if I'm wrong, but if we renew at our current benefit level, not change anything, it's the 120 per member per month. And then if we go to the choice plan that we're suggesting with the increased allowance, frame allowance, and contact and lens allowance, it's the 112. Correct, Rachel?
You're right.
Okay.
Yes. Sorry, I didn't have this exact sheet in front of me. I had all of the different options.
Yeah.
So yes, your current plan today is Signature, and we're actually recommending moving to choice. And the only difference in that move is it's the same exact doctor network, so there's no change in doctors. However, you do have just a little bit less in discounts on the non-covered lens options. So today, you've got about 35 to 40% off non-covered lens options. That would move to 30% on choice. It's extremely minimal. When I tell you it's pennies, it's pennies. The only other difference is in the out-of-network reimbursement schedule. Obviously, we want to keep members in network. If they were to go out of network, their reimbursements are going to be just slightly lower than what they are today. So under choice, you're basically getting the exact same benefit, only you're getting higher. You're getting a higher frame allowance and a higher contact lens allowance. And you're getting the same network. Everything is staying the same, just some of the discounts are a little bit less. But ultimately, moving to choice is a cost savings. So I hope I answered that correctly for you, or at least I gave you what you were looking for.
Yes, thank you. Any other questions, Rachel?
And I just wanted to make one other comment on this. I will say that I believe it's like 70% of VSP's book of business is on the choice plan today. So it's the most common, it's the highest utilized plan that we offer today. So you're not taking a step down in coverage by any means. Again, it really boils down to network, and the network is identical. So you're getting a decrease in the rate, and you're keeping the same network and ultimately better benefits, except for on the out-of-network schedule, which, you don't really want members going out of network. So
Okay, any questions?
that is that.
Question? Go ahead, Jeff.
Yeah, thanks. So earlier you had mentioned $1.15. Is that the current per member per month price?
The current is actually 114.
114. Okay, thank you.
So I have a question.
Go ahead, Rachel.
So this is Rachel Drake again. The choice plan has a lower out-of-network reimbursement. Now, to be completely honest, when members talk about the VSP program, they consider it a minimal coverage. It very rarely meets their needs. And I'm going to speak up as a member who has gone out of network because I can get lower cost overall. So what actually is the out-of-network reimbursement on choice?
Let me pull that up for you. Give me just one quick second. I actually have a comparison sheet that I can show you here. Give me 1 second. Okay, here we go. Just going to scroll down to that portion so you don't have to go through all the reporting here. Okay. All right, I'm going to go ahead and share my screen just real quick here. Okay, so if we go down to right here, this is a comparison, and I'll move it up or down if you can't see all of it. But what we're showing here, signature is going to be on the left side here, and then choice is on the right. And when you look at the out of network specifically.
Can we make it a little larger?
Yes, I'm sorry. How is that? Is that any better?
Better, thank you.
I can go look at. Oh, no problem. So if we look at the out of network here. Oops. You know what? It may not break it out. I don't think it's going to break it out here. But what I can tell you is that currently your benefit with Signature covers non-covered lens options with a 35 to 40% discount. This is probably the best I'm going to be able to get for you, Rachel. I apologize. Under Choice, it's 30%. So it's a difference of about 5 to 10% on non-covered lens options. And on the out-of-network, I might have to send that in a separate email, and where I can send that to you if you'd like. It's very, very minimal. I will tell you that. It's very, very minimal, but I don't have that in front of me. Yeah, I don't have that here. I apologize. If you'd like, I can definitely send that over to Laura, and maybe that's something that she could share with everybody.
I think that'd be great. Thank you.
Absolutely. And I will just end on this note, there are obviously, changes that we can make to the vision plan. We can make it as rich as you'd like. We can, keep it pretty basic. So, there are options. So if you're looking to maybe, do something in the future as far as like a base buy-up, then there's all kinds of options. So keep that in mind. And I will get back to you with the out-of-network reimbursements for both Signature and Choice.
Okay. Thank you very much.
All right. Thank you.
Open this up for discussion among the committee. Yes, Diane.
Diane Lyon, I have a question, well, two things actually. I want to piggyback off Rachel's thing about the frames, because that's the biggest thing I get in transportation among the drivers and aides, is that we don't cover enough on the frames, because they start shopping around and they can't get what they want because, we don't cover that much. And so anyway, it becomes a hassle. That's their complaint. And then number two, there's one thing that's not on here, and tell me if I'm not supposed to talk about it, but that would be an improvement if we're talking about improvements in vision in our glasses and stuff, ability to get things, is the scratch resistance on it. And the reason I say this is twofold. One, I know there's hazards to a job and it comes with it, etc. But I want to speak for special ed aides because I've been there. And then two, transportation. With the kids, the population that we work with, it's not, I don't get it because I'm getting it because I like it. I like to pay the extra money and stuff like this. I'm getting it because I have to have it on there. If I don't, when those kids take your glasses and you try, and there's as hard as you can try sometimes, the behavior ones will get a hold of your glasses and they don't just throw them, they fling them. So they're going to land at the window of the bus, the floor of the bus. If they hit the floor of the bus, they're scratched, no matter what. So that's kind of, and the reason I'm asking is I'm not trying to prove just one sector. It would be all the, the employees in general, but it just happens to be us that gets the most of the grabbing and things like this, physical contact, in other words. So that's something I'm wondering if we can't discuss to help, in the vision section. Thank you.
Maybe Rachel can speak a little bit more to that, but so we brought you the options that we felt were best in terms of giving members either what they're currently having or hopefully something a little bit better at a price where we're not looking at having to increase the contribution towards our vision plan rate, because we voted for a 0% rate for next year. So I'm not Rachel, so I can't say they're all of our choices, but for what we looked at, these were kind of our choices in terms of keeping the plan at the 0% and not increasing that vision premium. But it doesn't mean we certainly can't look into that as well, just to see. And I don't know, Rachel, do you have more to add on that? I don't know what you call it, the anti-scratch lens option?
Yeah, what I would probably say, because to your point, Laura, I know that you were definitely, the district is looking at, keeping costs the same and not having an increase for members. And I think what you selected is perfect, to be able to do that. I would say my only recommendation might be to add, I know we had kind of briefly talked about this, is maybe look at adding a high plan. So members have the option of staying right where they're at today and not having an increase, or having the option to buy up into something that's a little bit more customized for your folks specifically. We take a look at all of your claims. We know what members are purchasing. We know how much they're spending for frames. And we basically build a plan that is meeting the needs of all of those members. And then that buy up allows them to voluntarily buy up into that plan. So the cost is hitting them, not the district. So that's always, an option. We do have a lot of clients that do add that because honestly, not every vision plan is built for everybody. So we want to personalize it and customize it where we can. And that typically comes in form of a buy-up plan where we have the higher allowances. We have some of the covered lens options like scratch, but it also kind of shifts some of the cost to the member. And on the scratch, and I'm so sorry, I think Rachel, you had asked the question. Right now, you do have a discount on that, but it's not something that is covered unless we actually covered that in full. Regardless of your plan today staying the same or moving to choice, you would still just have a discount on that.
And that might be something, obviously we're starting the plan year, but that might be something we look at over the course of the year because like when we meet with our American Fidelity reps, we're offered a lot of different things that we can choose from. And that might be something to think about, whether it would be advantageous to offer something, but that's something we can look at over the course of the year too, maybe.
Right, and Rachel, I think I asked you this question, but I can't remember for sure, so sorry. If we move towards one of these options into a new renewal contract, and are we able to add the buy-up later within that same contract period, the buy-up option?
Yes,
Okay.
and you did ask me about that, and yes. So with our recommendation, we would be looking at a 4-year renewal. You can make mid-contract changes. We prefer, if you're going to do that, to try to keep it like on a plan year. So if your plan's effective 1/1, if you make changes mid-contract, we want to keep it on a 1/1. But we would certainly be able to make changes and add a buy-up later on during the contract, for sure. And we would even keep, whatever plan you decide on for 2023, that would stay, unchanged. We would keep the rates in place, plan in place. We would just simply be adding another option for members to select from. But yeah, the base buy-up has been probably the most popular upgrade, if you want to call it an upgrade, but really plan selection, because I think members really like to have choice. They don't like to be buying into something that doesn't really meet their needs. So that buy-up plan really is designed to meet the needs of the member, but also shift some of the cost to the member as well. They're kind of getting what they want, so they need to pay a little bit for that. So we can definitely look at that later.
Okay, another question, Dawn?
So going forward, this is actually a suggestion that since she said she can break down what our members are using, I agree because I'm just a klutz, so I have scratch resistant. But I think we do need to see what is the list of things our members, the employees are using. So over the next year when we come to look at the next year's contract and possibly a bump up or a buy up, what do our members need from it? So if we can continue to have this conversation and have those breakdowns, that would be great.
Rachel?
So on top of that, I think that we need to, as a district, do some surveying of our members and find out how many people are going out of network. Because I'm going to tell you, I'm one of those people that's listed as an exam only because that's the way I have to work it. And so unfortunately, VSP won't have all the information that we need. We're going to need to make sure that we get it through multiple venues.
Yes, and I would definitely recommend, by all means, and I tell all of my clients this, anytime that you're looking to add any type of plans, don't just assume what the population wants. Always, if you can swing a survey, that's the best way to go, because your members will they'll voice their opinions and they'll tell you exactly what they would like to see. And really, if it comes down to them needing to pay for those services, they elected that, so they can pay for it. I did just real quick, since I have you on the line, I'll make this real quick because I know you guys, I'm not the only one on the call today, but I did want to share one quick report here. So we have a ton of reports, but the one I think that you would probably find pretty useful is the non-covered lens option savings report. And this is what we look at when we're designing a plan, because this will show you what all of your members are buying today that is not covered. So this is for obviously the school district. It's the last 12 months of data. You can see that 33% of all non-covered lens options were for anti-reflective coating. Scratch is definitely on here. It's not one of your top enhancements, but it's also a very inexpensive impact. So if you wanted to add scratch resistant coating to your plan, it's about 1% to 2%. So it's very, very minimal. You look at some of these other higher ones like the progressives, that's when you really start to see, the cost impact. But we can provide this for any time frame that you'd like. We can also provide you, with our frame report. So I know, Rachel, you had mentioned a lot of the folks that are spending it, considerable more than that $130. We can break this out by increment. We can do it by $10, $20, but you can really see here, your members are definitely spending more than $130. So our recommendation would be, if you're going to have a high plan, start that at maybe $200, $250, because that's what your members are buying. So we have all of this data. When you're ready to look at that, Laura, you can let me know what reports you want to see, and we probably have all of that. But I would still do a survey to see what your employees would like to see, and we can build it around that.
Any other
And
questions?
I don't know what your timeline is too, but it wouldn't, if you wanted to add, a buy-up plan for next year, it's not too late to do that, at least on our end. But I know you guys, want to do the survey and have some discussions, but, if you wanted to add that sooner rather than later, that's fine with us. We can provide you what you need.
Okay, thank you. Any other questions, discussion? We're looking for a possible motion to approve the contract. And I believe this is something that has to then go to the school board in August to be included for our benefits in January. Jeff?
So I do like that this offers employees choice and is 2 cents cheaper per member per month. So I'll motion that we recommend to that the superintendent renews the vision program contract renewal with VSP to include the choice plan with an increased frame allowance of $170 and contact lens allowance for $140, effective January 1st, 2023, for a 4-year period and an annual amount of $108,219.
Dawn, that's your very second.
Okay, it's been moved in second. Discussion, Diane?
Yeah, why, if people can't get what they need or want at the 170, why are we just keeping it there?
I get the impression that you didn't want to increase the cost, because then we have to look at what we're paying per member, and then insurance rates, because then we have to look at where are we going to cut to make up that difference in the insurance rate that's been approved already by this committee. So we've already agreed what our rate is going to be for next year, and any change that we make that goes up would then impact that rate. So and I agree that we're not, I certainly know that 140 didn't, or 170 wouldn't have covered my glasses when I got my glasses. But, it was a lot cheaper because 170 of it was taken off, or at that time it was 30 or whatever it was taken off, so it's helpful. I don't think that, for the most part, our plan has ever been, I think Rachel made a point that it's a sort of a supplement, it's going to supplement what you're going to pay out and make it a little more affordable. This is going to make it, I think, even a little more affordable ultimately, but no, it's not going to be covering things 100%, unless you, I mean, you know, my eye doctor, when I went, you know, it's like, these frames over here, probably most of them will be covered by your insurance, but if you want to get something else, they're over here, and go ahead and look around. And of course, I looked at those, I was like, and went over and got what I wanted and paid the difference, so.
So, then technically what could happen is, we go with this now, so, you know, pretty much cut and dried. But it could always be brought up again after we see how things go for this next contract. You know, what people are picking, prices and stuff like this, how they're.
I think if, as a committee, we want to explore giving people an option where they can bump up and purchase, like they do added life insurance, or they purchase cancer insurance or whatever, an increased benefit. I don't think it would be extremely expensive for them. I don't think it would be a huge amount from what I'm seeing. We could explore that as a committee. I don't think it would be possible to do that by January 1st and get that out in planned documents, so we would have to do it for the next year. But I think we could spend part of this time, maybe a couple of insurance committee meetings, talking about it, and then vote for, you know, the next plan year to add something so that people could do that, or even look at what would it cost us as per member, and do we want to, you know, think about just doing it? And if it causes a small rate increase, then we have a small rate increase. We've added benefits in the past, we've reduced and we've added and cut benefits, so it's certainly something we can talk about.
Okay, thank you for explaining that.
Any other questions, comments? Okay, so it's been moved and seconded that we, I'm not going to read the whole motion again. Does anyone need me to read the whole motion again? Okay. All in favor, please say aye.
Aye.
Opposed, say nay. Okay, motion is adopted. Okay. We'll go to 2.05, presentation and discussion and possible action to recommend that the superintendent renews the agreement with Included Health to provide expert medical opinion service and reports beginning August 1st, 2022 through December 31st, 2025. Approximate amount of $420,000 for the contract. And this is the new Grand Rounds, right? Is that correct?
Yes, it's Grand Rounds with their new name.
Okay, great.
And we have, Krista, are you there?
Hi, all. Yes, I am.
Okay.
This is Krista Fisher from Included Health. Laura, are you planning to pull up the proposal?
We have it up. We have the first page there. It's
Okay.
do you just direct us and let us know if you want us to.
Okay. That should work. I can just
Okay.
see the room,
Oh,
so I'm not able to see what
oh,
slide you're on.
okay. Let's
You
see.
all look lovely.
Veronica's working on changing it.
Okay. Perfect. There we go. Perfect. So if you could scroll up to the first slide. Wonderful. Okay. Well, thank you for having me today. And it was great to see you all a couple months back in April when I was able to be there in person and really get to do a deep dive on our services, what we've been doing for
Hey, Krista, you have cut out. I'm not sure if it's on our side or your side.
Washoe County. Are you able to hear me at all?
Now we can. Sorry, we didn't hear anything you said, though. Sorry, Krista.
Okay, that's okay. Yeah, I think I've got pretty great connection over here, but let me know if it cuts out again. So I was just sharing, it was great to be there in person a few months back in April and do a complete deep dive on the services that we've provided for Washoe County members over the past 3 years. And also what those numbers have looked like, the impact that we've had. So it was really nice to see all of your faces and be there and share a little bit about what we've done for the past 3 years. And today, really hoping that what shines through is just the partnership and the value that we place in our partnership with Washoe County. Laura has worked really closely with I over the past few months to negotiate and really come to the best.
Okay, Krista, we're losing you again.
Laura, are you able to answer questions about this?
Probably. I was just looking at where am I bringing my other numbers? Now I have it though.
Robert.
Don,
Okay.
yes.
Don Echeverry, for the record. Because we've seen the presentation, I'm comfortable with this program. So
What cases we really take on are the
She's just going to town.
yeah. I only have one question.
business staff. Was there a question?
It is prior commission.
We're having trouble hearing you. You're going in and out. We've heard like 4 words total.
Oh, no.
Now 6.
So I just have one question this time.
Krista, if you want to explain the renewal, I think most people are ready to hear that, and maybe a couple questions as well.
Sure.
Okay.
Access to our quality referrals and our triage line. And if you want to jump a couple slides, I think it's the next one that really details. Yes, exactly.
any questions? Yes, Don.
What is our current cost?
So the current cost right now is, you are contracted for 50 case bundle annually, and those cases are $3,800 per case.
And we're going to 40 at 3,500, so that's going to go down in cost total? Okay.
Correct. And you're adding in 2 additional service products through the concierge referrals and the triage line.
And the committee's seen a presentation on this, so I think we're all pretty familiar with it. But my question is the new triage line and that type of thing. People, any members could call, get answered, even if they're not already one of these cases. That's what I'm hearing, right?
Absolutely, yeah. And this is something we've actually done for certain cases. We've gone ahead and either provided the concierge referral and made that scheduling just because we felt, in that case, that expert case, that member really needed the additional support. And so we provided it anyways, even though it wasn't a part of the contract. But going forward, we'd be able to market this and advise members they have this. And yes, you're absolutely right. They don't need to have an expert medical opinion to utilize that triage line and talk to a on-staff clinician.
Awesome, thank you. Any questions? Okay. We are looking, I think, to try to get this so that they can go into the new contract year. If anyone would like to make a motion. Go ahead, Don Miller.
I move that the
Yes,
Washoe
sir.
County School District Insurance Committee recommend the superintendent renew the agreement with Included Health to provide expert medical opinion service and reports beginning August 1st, 2022 through December 31st, 2025 in the total approximated amount of $420,000.
Okay, any discussion? Diane?
Oh, no. I
Oh,
was just
second,
saying-
sorry. Sorry, Diane seconded it. Any discussion? Okay, seeing and hearing none. All in favor of the motion, please say aye.
Aye.
Opposed, nay? Okay, motion is adopted. Okay. 2.06, approval of the minutes from May 25th, 2022. These were emailed out. I'm sure everybody got a chance to look through them. Is there any discussion? Yeah. Go
I
ahead,
had
John.
a change on page 3, the last paragraph. It says, Member Jeff Bozzo stated July 1st, 2022. That should say July 1st, 2020. That's all I have.
Okay, so that just needs to change the year. Okay. Any other changes or discussion? Okay. Is there a motion to approve the minutes? Tony?
Tony Marestio, I move that we approve the minutes as written
Okay.
with one change.
With the one pointed out changed. Okay. Any second for that? You don't want to second it?
I'll second it.
Thank you,
It's
Rachel.
Drake.
Okay, it's been moved and seconded to approve the minutes for May 25th, 2022 with the one correction. All in favor, say aye.
Aye.
Opposed, nay. Okay, that has been adopted, motion's adopted. Public comment, if there's any public comment, 3.01? No, seeing none, hearing none. Okay, our next meeting is August 24th, 4 PM, same time, same place, right?
Yep, and the new fiscal year meetings invites will be sent out soon from Veronica, so just keep those. But yes, it's the 24th.
Okay. Okay, any questions, comments? Okay, meeting adjourned.
Okay, back with